Hey there, thanks for watching. Dr. Erickson, EHS, Physical Therapy, Chiropractic, as well as the herniated disc fix expert. So the question is, if you have arm or leg weakness or atrophy, will you need surgery? So this can happen, not often, but it definitely can happen when you're dealing with a disc-related injury that's irritating, one of the nerves that comes down either into the arm or into the leg. And we'll kind of look at, what it looks like on some of those, what's called dermatomal or myotomal patterns. So dermatomes means you can feel the sensation or the symptoms in certain areas, right? So maybe down this way or to the thumb, like C6, C7, C8, kind of look at that picture there. But those nerves also carry motor function. So they can inhibit or impede that signal from your brain. Your arm or your leg can feel weak. And when that happens for long enough, it can actually create some atrophy, meaning the muscle itself gets a little bit smaller compared to the other side. And that can happen from disuse. Obviously, I'm hurt. I can't move. I can't, go to the gym as much as I want to because my arm or my leg hurts. And in combination with that, the nerve, the information coming from that nerve is just kind of shut off, or it's being reduced, so that muscle no longer is getting the good signal, meaning that the muscle kind of shrinks up. So do we need surgery? Does it require surgery? It's definitely one of the red flags that if it's constant and it's progressively worsening, where you're falling, you can't pick things up, and it's dangerous, then yeah, it definitely is worth a surgical consult, and that may be the route you need to go down. If, however, it feels like it's intermittent, it comes and goes, you can do certain things to improve that feeling of strength, then there may be a good chance that we can work conservatively into specific movements, end ranges, loads to help centralize, right? So different picture up there, centralize, move that symptom from the periphery or the somatic or that sensory, right? The symptom, and also the myotome, which is the muscle. We can move that up and out of the leg or arm, and then many times that improves the strength as well. So there'll be times when you have weakness with tricep or weakness with bicep, or weakness in the, maybe with the pushing the toes down, so coming up on your heels, S1, or, kicking the leg out, L4, L5. Those are things that we have to test. And if we can quickly change that based on repeated movements into a certain direction, bending forward, bending backwards, side gliding rotation, then there's a good chance that you can get it without surgery. So could you require it? You may require surgery, but there's also a chance that you can get it conservatively. And the reason that happens typically is there's a disc, like I said, we talked about earlier, disc-related injury, where a piece of that disc tissue is budding up or causing an irritation, whether it's compression, a stretching, not enough space or room, or inflammatory response on that nerve root. And certain roots innervate certain muscles. It's just how we're built. So if that one's not working right, if the information is not flowing through, like when you pinch a hose, the water doesn't go through as well, so you'll feel weak. Your brain's telling it to move. You just don't feel like you can do it because there's that loss of connection, or that loss of signal coming down the nerves. So once we can, if we can move that out of the way, then it restores that strength as well as makes the pain go away. But that's generally how that works, and I just wanted to give you that bit of information to help you out as much as possible.